Hello and welcome to Wellness Wednesday. I'm James Currie with the Communications Department here at MCHD, and I'm talking to pediatrician Dr. Deborah Walks, and we're going to be discussing telehealth today. Dr. Walks, how are you?
Doing well. Thanks for having me, James.
Yes, ma'am. Tell me a little bit about the obvious benefits of telehealth.
Right. Well, telehealth, as you know, is conducting a medical visit over the phone, and it can be done with just a phone call with audio and video, and it's super convenient to the patient. It can be done, in the comfort of their living room. I've done telehealth in backyards. I've done them in parks. I've done them in parked cars. I won't do them in cars that are being driven, but so it is convenient. It's wherever the family can do the appointment, so that makes it very convenient. It's also very accessible. The appointment times are generally open, so everyone's busy, and so we can usually fit them in a time slot that is convenient to them. So, and the other nice thing about telehealth is it keeps people safe. Telehealth appointments have increased tremendously since the COVID pandemic began, because people can stay home, not come into clinic, and be exposed to the COVID virus, as well as other viruses that are circulating right now, like influenza or influenza-like viruses. So it keeps people safe, which is really nice for patients and caregivers of patients who may have chronic medical conditions or high-risk conditions that put them more at risk if they get an infection with one of these things. So it's safe, accessible, and it's very convenient.
And you said safe, and it's safe in more ways than one, because we're also HIPAA compliant, so privacy, so that communication is just between the patient and you, and there won't be anybody else nearby or listening. So it's safe and secure.
Exactly. We make it a point to be HIPAA compliant during the visit. When I do a telehealth visit, I'm in a room in my home that I'm the only one in the room. There's a locked door, so no one else is in there. So yes, it is HIPAA compliant. It's very secure.
Now, those are the benefits. I mean, there are some things obviously you can't do through the computer or telephone. So can you kind of go through some of the things that maybe people don't think that are so obvious that you just can't do over a visit like this?
Correct. And, we can do a lot of things. Let me start with what we can do. We can do many medical problem visits over the phone. Your typical cough, runny nose, even fever, vomiting, diarrhea. Behavioral issues are very easily attended to on telehealth visits, like ADHD, depression, anxiety. Things that we can't, let me also mention things that we can do. We can fill medications. We can refer to specialists on a telehealth visit. So there's a lot of things that we can do through telehealth. Unfortunately, we can only do a limited physical exam on telehealth. So we can't do complete exams. We can't lay our hands on a patient, obviously. And therefore, at this time right now, in pediatrics, we are still doing our well checkups or physicals, sports physicals, things like that in person. We can't do any lab work in a telehealth visit. We can't check vital signs during a telehealth visit. So occasionally after a telehealth visit on the same day or the next day, whenever it's convenient for the parent, I will bring a child into clinic to do, say, a lab or a vital sign to augment the telehealth visit.
Well, thank you for going over those. Now, it's traditionally the same way to make the appointment, or how is it different now to make the appointment during COVID?
Well, it's actually the same way. You call the health department for a telehealth appointment. It's 251-690-8889. That's the appointment line. And you'll be directed by the phone tree how to get a telehealth appointment, and it will be scheduled. And then on the day of the appointment, what happens is you will get a link sent to either your cell phone or an email. So it's done either through a text message or an email. And then if we're going to do a video, I can get a video done on either a cell phone or through your laptop. Internet helps a video connection to be a little bit better, but it's not required. And we can also do telehealth visits without video. I've done telehealth visits with just audio, with just a phone call. So a video is not required. It does help. It's a little bit better visit if we can get the video in. I will say also that having the child at the telehealth visit does help. It makes the visit a little bit more accurate. But I've done many telehealth visits just with the parent without the child there. So having the child there is not a requirement either for a telehealth visit.
That's good to know. Yeah, it seems like there's been a lot of barriers for appointments and things like that, but obviously this is removing one of those obstacles. So, we're always available.
Mm-hmm.
You're always available. Kids get sick, whether it's COVID or not. Flu season approaching. Anything you want to say real quick about flu season, flu shot?
Well, we definitely want people to not get the flu during this pandemic. So would encourage everyone that's 6 months of age or older to come in and get their influenza vaccine, which the flu vaccine is extremely safe. We've given millions of doses over the last 50 years, and it has a high safety profile. So please come in and get your flu shot.
I got mine too.
Awesome. Great.
All right. Well, Dr. Walks, thank you for telling us about telehealth. And if there's anything else you want to add, go ahead.
Well, I look forward to seeing many of our patients on telehealth. I think you will like the accessibility and the safety and the convenience of it. And hopefully we'll be able to meet your needs through this program that we have set up. So thank you for letting me be here today.
Yes, ma'am, Dr. Walks. Thank you for calling in remotely.
Okay, take care.
You too. Bye-bye.
Bye-bye.